Welcome once again to the medical student second year whom join us in this series of lecture in the cardiovascular system physiology. In the previous lecture we studied the arrhythmias, which is deviation from normal sinus rhythm, either arise in SA node, and we study the sinus tachycardia, sinus bradycardia, and atrial cell we study only the premature atrial beats or contractions, AV junctions, and ventricular cell we study ventricular premature contractions or beats. Today's lecture is the few points about the arrhythmia above AV node, what's called supraventricular node, and some common arrhythmia example of it's in a ventricular arrhythmia. So we will a few points about atrial fibrillation, atrial flutter, and the SVT, what's called paroxysmal supraventricular tachycardia. Look to this ECG. As we know from the previous lecture, to start with the rate, this is irregular. See, this is RR wave is not like that, and this RR wave quite different from other. So if we take large boxes 1, 2, 3 and divide this the rate about 75, this the rate about more than 100. So as we know, we will count the numbers of for 3 seconds 15 large square 1, 2, 3, 15 large boxes, and number of RR wave time by 20. So the rate nearly about 100 beat per minute. About 5, 1, 2, 3, 4, 5 between these 15 big square time 20, about 100. It's definitely irregular. The RR wave is not look alike in whole that this ECG strip. An irregularity is irregular by itself, not repeated. This not like that, and this RR wave is not like that. So it is irregularities. P wave, there is no P wave, only there is some undulation in a baseline. This undulation might be fine like that, might be coarse. This is called small f, or F wave. That the PR interval, we can't measure it. There is no P wave, so we can't measure it. QRS complex look normal, look alike in all these. So that the impulse, as we know, it's from above the ventricle, either in the, if the QRS complex is normal, either in SA node we will find P wave, if atrial like that, or the AV nodes, or then bundle of which the QRS complex will be normal. So this, the interpretation, this is what called atrial fibrillation. What mean by atrial fibrillation? Atrial fibrillation, no recognized atrial depolarization. There is no P wave. So no normal P waves. Impulses are not originated in SA node. SA node, there is a P wave normal, QRS normal, like a sinus rhythm as well. Atrial activity is the chaotic, and I mean it irregular, in a chaos, resulting in irregular rate. Commonly affect this, the atrial fibrillation is a common rhythm, affect 2 to 4% of adult population. When increasing age, it's increasing more the prevalence, so it is up to 5 to 10% in people who are older than 80 years of old. Look how common is the atrial fibrillation is. Atrial fibrillation, the recent theory suggests that it is due to the multiple reentrant or circuit. This will be discussed in the fourth year, but nowadays there is abnormal way of producing this called reentrant. wavelets, a number of stimulus and wavelets in a different directions conducted between the right and left atria. It's originated in atria, either a way in different way. Impulses are formed in the totally unpredictable fashion, as we saw in chaos. The AV node allows some of these impulses to pass through the variable interval. Not all the atrial contraction. It might need to reach 300, 400 beats per minute, but not all these impulses passes, only few of them. So the rhythm is irregular. This is again the baseline, little bit coarser than previous. There is no P wave, no PR interval, and it is RR wave, quite different from one peak to another. For it's irregularly. There is no P wave, no PR interval, normal QRS complex. The rate we can calculate by 15 square and times by 20. Again, this is the look at the coarse baseline, different from previous, and this is slow. It means if we count 15, it will be found is less than 100. If we count 15 x squared, this is about 130 and above beats per minute. There is no P wave, and there is no, we can't measure PR interval. In both of them, normal QRS complex, so it is called atrial fibrillation. If we count the rate, this is 1, 2, 3. Between these, it will found between these, it will arrow, yellow arrow is found about less than 100. Here about 130. Again, this is the 12 lead ECG. This is the bipolar limb lead 1, 2, 3. Unipolar limb lead, AVR, AVL, and chest lead, and this lead 2, what's called for rhythm analysis. If we come to the rhythm, this is there is no P wave, there is no, we can't measure PR interval, RR different from the here and there, so it is irregularly, and there is no QRS complex look normal, and the rate here about, we can take 15 big square and count about 20, and this is what's called atrial fibrillation. Come to the next rhythm, and the rate we can find it about 70. 1, 2, 3, 4, 5, and the plus small square, so 75 minus 5, 70 beats per minute. Regular RR waves equal, so it is regular. PR interval, P wave, there is no P wave. This look like that, which is P wave, all replaced by what called flutter wave, capital F wave, like the sawtooth appearance. This is the flutter wave. So flutter waves, there is no P wave. PR interval we can't measure. And the QRS duration normal, still impulses coming from above the ventricle, and this is what called atrial flutter. And the regular, the atrial rate is about 300, even 600, while the ventricular rate is the fraction of either 2 and 1 pass, or 3 to 1 pass, most common, or every 4, like that, 1, 2, 3, 4, 1 pass. It's 4 to 1, this what called. Sometimes most common 2 to 1 or 3 to 1. The atrial flutter, no P wave. Instead of there is a flutter wave, sawtooth appearance. If we reverse the ECG, look the same. I mean reverse it upside down. What called sawtooth pattern are formed at the rate, I mean P wave, there is 250, even 350. While not all these passes to the AV from AV node, some it's either every 2 1 or every 3 to 1 is the most common. So 2 to 1 or 3 1. What atrial flutter? Also re-entry or recircus pathway in the right atrium with every second or third or fourth impulse generating QRS complex. Other are blocked in AV node as the node repolarized. This is the 3 to 1, 1, 2, 3 every, and it's regular, no P wave. There is a flutter wave, sawtooth appearance, and the QRS complex normal, no PR, so it's called the atrial flutter. ECG characteristic of atrial flutter is the sawtooth flutter wave or sawtooth pattern. Look to this ECG. The rate is different. From there is about 74. From there is the 148. It's a regular and regular there. So it's regular here and then regular if it's become rapid. P wave, there is a P wave, there is a P wave, there is a P wave. This is a sinus, but there is no P wave. This is a regular and this is a regular. And PR interval, we can measure it's normal in this sinus, there is no PR interval. QRS complex normal in both of them, so it is the impulses is coming from above the left ventricle or the ventricle. This is what called the SVT, paroxysmal supraventricular tachycardia. Regular, there is no P wave, PR interval, usually initiated by ectopic. There, ectopic is not seen in this. Ectopic and this coming, what called SVT or supraventricular tachycardia. SVT or supraventricular paroxysmal because it's coming and stop, it's spontaneously sometimes. So it is paroxysm, it comes in occasion. The heart rate suddenly speed up, often triggered by premature atrial contraction, not seen in this ECG. And the P waves are lost, usually lost. So it's not a normal sinus rhythm deviation. As we said, every deviation from normal sinus rhythm is called arrhythmia or dysarrhythmia. Paroxysmal, it coming in paroxysm, usually initiated by ectopic there. The rate is regular, there is no P wave, no PR interval. There are several types of paroxysmal supraventricular tachycardia, but all originated above the ventricle, therefore called supraventricular, and therefore QRS complex is narrow and normal. Most common abnormal conduction in AV node, what called reentrant circus looping in AV nodes. This reentrant circuit will be discussed when study arrhythmia in a fourth year. Look, this is a normal sinus P wave QRS, normal sinus, and the regular PRR equal, and then speed up. There is no P wave, no PR interval. It's irregular, but the rate is become about nearly 200. Nearly 200. This is the rate about 1, 2, 3, 4, about 75 or 78 beats per minute. This is what called SVT, supraventricular tachycardia. What coming is the two important arrhythmia is the ventricular tachycardia VT, ventricular fibrillation VF. If we do a report for this ECG, the rate about 160 beats per minute. Look, the RR wave could be nearly regular, but it's different in voltage. This low, this high, this low, this high. What called electrical alternance. Regularity seems to be regular. P wave, there is no P wave, there is no PR interval. A QRS complex wide. This is about 5 small boxes, nearly more than large boxes. So it is more than 3 small boxes, which is upper limit of a QRS complex. The shape is bizarre, but look alike there. The same, except from voltage. Some is high, some is low. This is what called ventricular tachycardia. The ventricular tachycardia impulse originated in ventricle. That is why the QRS complex is normal. No P wave because the impulse not in atria, not in SI node. Why the QRS complex? And there is an reentrant also, by the way, looping in a ventricle, most common cause. Ventricular tachycardia can sometimes generate enough cardiac output, sometimes, but usually there is no cardiac output, and the patient compromise, hypertension or shock, and what called hemodynamically unstable and need urgent interference like DC or other. So it's serious rhythm, usually from the myocardial infarction. So ventricular tachycardia rate usually between 100 to 120, even more. There is no P wave, QRS complex, white and bizarre morphology, rhythm, 3 or more ventricular ectopics, and they come in a row, and it is last more than 30 seconds. Ventricular tachycardia almost always, as we said, is a pathological. The most common cause, coronary heart disease, acute MI, digitalis toxicity, congestive heart failure, ventricular aneurysm, and other causes. Usually the patient hemodynamically unstable and need urgent interference. Look to that, the QRS complex, wide, bizarre, no P wave, no PR interval rate. This is about 180 more than, and the voltages, they are coming different from every other beats, and look alike QRS complex. This is what called ventricular tachycardia or VT. This 12 lead ECG and the ventricular tachycardia with rate nearly about 280, and the QRS complex look alike, so it is called monomorphic. Sometimes in the VT is different. This is the VT, ventricular tachycardia. Look to this ECG. We can't measure the rate. There is no rate. Regularity is completely irregular. And there is no P wave, no PR interval, even no QRS complex. There is no, this is look like QRS, but usually there is no QRS complex. The patient usually unconscious, cyanosed, there is no pulse and blood pressure 0. This is a serious rhythm, what's called atrial fibrillation. And this atrial fibrillation, the most common cause of death in the acute myocardial infarction, it is really the patient in a physiological death. It needs interference within within a minute. Otherwise, the patient will be in a serious situation. Hemodynamically, usually unstable. It's deviation from normal sinus rhythm for sure, completely abnormal, and the ventricular cells are excitable and depolarize randomly, and the rapid drop in cardiac output and blood pressure and pulse rate and conscious, the patient sinus, and the death is occur quickly, if not urgently reversed to the normal, usually by cardioversion, DC. So ventricular fibrillation rate unattainable, we can't count it. There is no P wave, QRS complex is bizarre, abnormal, wide, even is not present. Conduction chaotic, electrical activity, rhythm is the chaos, electrical activity. This dysrhythmia result in the absence of cardiac output, pulse rate, and the blood pressure. Almost always occur with serious heart disease, special MI, and the patient in a physiological death unless it's urgently resuscitate the patient. It's a bizarre line. There is no P wave, no QRS complex, there is no rate. We can't count it. QRS complex is not present. And if we look to the patient in a serious situation, cyanosis, unconscious, and there is no cardiac output, and blood pressure, we can't detect it, and pulse rate, usually no pulse, so it is ventricular fibrillation. This is EC12 lead ECG, ventricular fibrillation. And again, this is another example of VF, ventricular fibrillation. See you soon.